Okay, so if you've seen our previous videos, you've got a good handle on whether or not upright posture is something that you should be working on. But what about the first exercise? Where should you start? Well, to figure that out, I want to teach you a quick principle when approaching exercises. If you have central or symmetrical problems that refer from your back, meaning it's either in the center of your low back or across your whole back equally, or you have nerve symptoms which travel down your legs, but it's give or take pretty darn symmetrical, then you're gonna follow this principle of going your forward and backwards plane only, the sagittal plane only, forwards and backwards. If backwards is not working, then the next thing you would try is forwards, because you don't want to leave that sagittal plane as long as your symptoms are staying either central or symmetrical. What if you have primarily one-sided symptoms or even have a mild shift, which means that your shoulders come a little bit to the side of your hips? If your symptoms are primarily one side more than another, well, your best bet statistically is actually still forwards and backwards plane, the sagittal plane. If you have one-sided symptoms, it means that the problem in your low back is shifted a little bit off to the side, but forwards and backwards movements are usually enough to bring it back over into the middle and help get rid of the problem. However, sometimes it's not. Sometimes the problem is a little bit too far over and forwards and backwards can't get to it. So if forwards and backwards doesn't work, you can move on to either diagonal exercises or lateral side-to-side exercises. If you have, the only exception to this is if you have a moderate or a major shift, so your shoulders are way far to the side of your hips, and that began after you at the time that you started having your low back problems. That's considered a relevant major or relevant moderate shift, and you should start sideways first. You should be trying to correct your shift first before attempting forwards and backwards. To summarize, for the majority of people out there, you just want to follow the KISS principle. Keep it sagittal, stupid. All right? For the most part, just assume you're going to start forwards and backwards. In this one, if extension doesn't work, you can try forwards flexion. In this one, if extension doesn't work, you're probably going to move to diagonal and or straight side to side, depending on what you're experiencing. I hope that helps. Keep following to get into the specific exercises in each one of these planes to try. All right, see you soon.